CFO, Ministry of Health, Dr. Tan Wu Meng.
Chairman, I beg to move that the total sum to be allocated for Head O of the estimates be reduced by $100. I declare I'm a medical doctor and I'm the son of a cancer patient. Today I'll speak on our patients and our healthcare workers, our healthcare system and our pandemic defense. On our patients, our people want to live at home. And sometimes when a patient has incurable illness, terminal illness, that patient wants to die at home as well. And so the care must follow the patient. And if the policy intention is to subsidize the care, it's important we look at whether the subsidy and support follows the patient as well, including into the home. It's important in end-of-life care, palliative care. It's important when patients are less mobile, because each trip to and fro for a less mobile senior can mean expenses on a taxi trip, a private hire vehicle, or even a private ambulance for some of the sickest patients who are based at home. It's important as family sizes get smaller, fewer children to share the caregiver filial duty of accompanying a parent to a clinic. Each visit, each trip to and fro means cutting into family care leave, annual leave from work, and sometimes that leads to friction with an employer. And it's often the less well-off workers with less bargaining power who face difficulty being a caregiver, because we know that while some employers are kind, some employers are one kind. Last year, during the debate on Healthier SG, I shared about one of our Clementi seniors. Amma was bedbound, not able to get out of the home, not able to physically get to the polyclinic nearby. Her home visit doctor wrote a prescription, but when the prescription was brought to the polyclinic, she had to pay unsubsidized rates for her medicine. She couldn't make use of her Pioneer Generation card because she wasn't physically able to get to the polyclinic, walk in the door, register as a subsidized patient, make use of that subsidy and the Pioneer Generation additional subsidy too. Minister Ong Ye Kung last year thanked my Clementi residents and I for pointing out, quote unquote, that healthcare subsidies should not be tied to services being delivered in brick and mortar facilities, unquote. Minister also said, quote, this will naturally have to be reviewed as we shift our paradigm, unquote. So can the minister share what is the progress of the review and what improvements are being looked at to support less mobile patients and seniors at home? Because healthcare is changing. Care is moving beyond hospital to community, MOH's own words from half a decade ago. The Healthcare Services Act recognizes that healthcare goes beyond places of brick and mortar. The National Electronic Healthcare Record also recognizes that patients move between different places of care, and so there has to be continuity of medical records as part of continuity of care. And therefore, it makes sense, it is a natural policy progression to look at how subsidy can be made more portable with appropriate processes and safeguards, to make subsidy more portable so that care follows the patient, including to the home for patients who are less mobile. Traditionally, MediSave was tied to the inpatient setting, but over the years, we now allow MediSave to be used for outpatient care of chronic diseases in the clinic. But more can be done, because some patients at home have medical conditions which mean it is very hard to move around, very hard to go out of the home to a clinic. Patients with chronic neurological conditions, such as muscular dystrophy or motor neuron disease. Some patients may be homebound because of old age, each trip going out not so straightforward. And there are also some patients, some seniors, with incurable illness, terminal illness, limited time left. And for these patients, every trip to and fro from a healthcare facility means less time spent at home, less time at home with loved ones in a place that they want to be. So it matters. So can MOH look at how healthcare financing and healthcare delivery can be made more portable for such patients? Subsidy, 3Ms, MediSave, MediShield Life, MediFund, so that care can be delivered at home, closer to home, especially if the intent is already to subsidize such care. When patients need to do a blood test a few days before the appointment, can MOH make it more straightforward for patients to have the blood test done at home or at a polyclinic near to home to reduce the distance traveled by patients and caregivers? Can MOH also make blood test forms more portable across the different public healthcare institutions? My Clementi residents tell me of fellow Singaporeans discharged from one public hospital, given blood test forms to be brought to their regular doctor at another public hospital, and the doctor at the second public hospital, the regular doctor, has to reorder, reprint, reissue the blood test form, even though both hospitals were part of the same healthcare cluster. There's more that can be done to make the journey smoother for our patients. In short, policy design must be about seeing through the eyes of our people, because that is how we make better policy and deliver better care. I want to move on to talk about our healthcare workers, and in particular, flexible work arrangements in healthcare. Amidst our aging population in Singapore, many healthcare workers are themselves caregivers as well. There's the filial son, the filial daughter, works a full shift at work in the hospital, comes home, puts in that extra mile for their parent too. Extra mile at work, extra mile as the caregiver after knocking off work, looking after an aged parent who may have dementia or themselves have a serious illness. There are single mothers working in healthcare on the healthcare front lines. When they finish their shift, they go home, look after the children, putting their full heart in at work and at home. There are also healthcare workers who themselves have special needs children at home. And each time a healthcare worker faces challenges with flexible working arrangements, it poses challenges at home as well. Some healthcare workers have themselves fallen ill with a serious illness, such as cancer. They've gone through treatment, fighting their way back to health, rebuilding their health even as they rebuild their work identity, trying to make progress, trying to come back to work, helping patients while recovering from their illness. So flexible working arrangements can make the difference between healthcare workers having to choose between their family and their job, or in some cases between their health and their job. Can MOH tell us how many healthcare workers left the workforce in the past 5 years, despite being still of working age? And how many former healthcare workers have returned to service in the last 5 years? I also want to speak for our older healthcare workers. These healthcare workers have served on the front line for decades, full of experience, wisdom, the journeys and wisdom of a lifetime. They still want to contribute, but sometimes they also are looking for flexible work arrangements if they have elderly parents at home. We should find ways to keep these workers in the workforce, serving as long as they are able to and wish to do so. Progressive, supportive HR practices. It matters in the workplace. It matters in healthcare. It keeps the workplace open to sisters and brothers coming from different backgrounds, different walks of life, different personal journeys. It helps us recruit and retain the full diversity and depth of talent and life experience that is Singapore. And all this adds to the team. because healthcare is a fundamentally human endeavor, no matter how much technology and science there is. Healthcare is fundamentally about human endeavor and humanity. And when our workforce draws on a full breadth of experience, life experience, talent, diversity, it helps our healthcare system. It makes our system stronger. It strengthens our ability to deliver care. I want to speak on our system of healthcare. Mr. Lim Seong Guan was former head of civil service. I remember a quote which Minister Chee Hong Tat mentioned in a speech at an MOH event in 2017. Implementation is policy. That's what Mr. Lim Seong Guan said. Implementation is policy, because the effectiveness of policy is not measured by how elegant it looks on paper, but how it is translated into reality during implementation. So I want to ask MOH some questions on implementation. On Healthier SG, what's being done to help family doctors come on board, especially at older clinics which aren't already digital? When can our residents start joining Healthier SG? What about patients with chronic disease already seeing an established doctor in the community? And how will the subsidy and financial framework operate for chronic disease medications? And how will it interlock with the existing model of care that many family doctors provide? And how will this connect with wellness and exercise programs in the community? Because my residents in Clementi and in Faber Hills within Clementi, they tell me that HPB at one point was cutting back on exercise programs in the community. And this meant that some seniors had to travel further in order to access their usual exercise programs of their choice. Implementation matters. On IT, information technology, with Healthier SG, many more GPs and family doctor clinics will join our national healthcare IT systems. We owe it to patients and healthcare workers to ensure these IT systems are best in class, not just best in Singapore, but best in the world. On New Year's Eve last year, the New York Times had a sharply written article on IT and software design and maintenance. The author talked about technical debt. Technical debt is the gap between what software is and what we want it to be. This technical debt is paid not by software developers or manufacturers. Technical debt is paid by users. In healthcare IT, technical debt is paid by patients and healthcare workers, waiting for computers to load, windows to open, how many mouse clicks, how many keystrokes to make something happen. In 2019, the last year before COVID, there were 14 million consultations across the healthcare system alone. If in each consultation you spend 1 minute less navigating the software, making things happen on a computer, that's 14 million minutes saved. 14 million minutes of technical debt. 10,000 work days or 27 years of someone working round the clock 24 hours a day. It's not a small amount. And with more private clinics plugging into the national IT system for healthcare, there'll be far more than 14 million consults a year, depending on that infrastructure. So it's all the more important we ensure our IT infrastructure in healthcare is best in class, not just in Singapore, but internationally, around the world. Last year I asked, is this something GovTech can look at? The minister in charge of GovTech also sits in MOH. Is there an opportunity for deeper synergy, a healthcare IT platform built by Singaporeans, for Singaporeans, good enough to compete against the best in the world? It's a matter of funding, willpower, ambition, and vision. I want to talk about why time is care. Healthcare economists talk about supply-induced demand, where in some countries, a patient might be encouraged to use more healthcare resources. The 1993 White Paper on Affordable Healthcare mentioned this. In short, there can be market failure. But there can also be other kinds of market failure. Let me talk about demand-induced demand. I spoke up on this 10 years ago in an article in the Straits Times. If a clinic is too busy and consultation times are too short, it becomes harder to promote health. 6 consultations of 5 minutes each are not the same as a half-hour conversation, especially when speaking with someone about quitting smoking, changing a lifestyle to save someone's life. And in our aging society, with patients having more medical conditions, our healthcare system must allow sufficient time, because time is as much a part of healthcare as clinics and hospitals, medication and technology. Time with someone you've just met to build trust and rapport for a long journey down the road. Time with a young Singaporean facing a mental wellness challenge. Time with someone who's just been diagnosed with a life-changing situation. And you're talking to that person, connecting, understanding their hopes and fears, preparing for the journey ahead. All this needs time. Time is part of care. And so whether it is our family doctors, clinics, operations, healthcare IT, or the real-world journey of patients and families, our policymakers must continue seeing through the eyes of the people to understand what happens in real life on the ground. Otherwise, even the brightest policymaker is flying an aircraft through a storm without instruments, not knowing the airspeed, altitude, how much is in the fuel tank. On our pandemic defense, we need to learn the right lessons of a generation from the crisis of a generation. Excess deaths, I asked this in Parliament. Can MOH give an update? What's driving excess deaths now that the reported infection numbers are subsiding? What was the impact of people delaying care and screening due to pandemic fear? Did socioeconomic status and housing affect COVID-19 outcomes and excess deaths? On securing our supplies in a challenging world, is MOH working with MTI to strengthen our supply chains? If there needs to be a new vaccine, can Singapore innovate and manufacture it onshore? I asked this in the budget 2 years ago. Learning from the lessons of PPE protectionism, where some countries impose export bans, will MOH consider working with MinLaw and AGC to study whether certain essential supplies purchased by the Singapore government can be gazetted as sovereign state property the moment the purchase is complete, even if the item is still in an overseas supplier's warehouse? The Senior Parliamentary for Health, Secretary for Health, serves in both MOH and the Ministry of Law, and I hope the agencies will study this too. Sir, in conclusion, I said this 3 years ago during the debate on the President's address. I'll say it again. Healthcare is about our people's lives, your life and mine, the lives of our loved ones, the life of every Singaporean. Last year, I spoke up to MOH about change, a change agenda. And as we emerge from the pandemic, it is a time for choosing how we shape the future ahead, because our policy choices today shape all our tomorrows, in sickness and in health. I beg to move. Thank you.